Have you noticed how often the word sovereignty is being used by political leaders today? The fight in Ukraine is about sovereignty. The worry about China in the Pacific is about sovereignty. Mind you, it's a pretty selective concern. We don't seem to worry about the sovereignty in Myanmar or in Sri Lanka or in Yemen, where it's estimated there have been almost 250,000 deaths since 2015 in a horrible war where all sides of the conflict are reported to have violated human rights and international humanitarian law. But I mentioned yesterday this wretched UN arm, the World Health Organization, which held a special session on December 1 last year, only the second since it was founded in 1948. Participants agreed to, quote, draft and negotiate a convention agreement or other international instrument under the Constitution of the World Health Organization to strengthen pandemic prevention, preparedness and response. Now, this is really critical. I mentioned to you that this was to be known as the Pandemic Treaty. The Director General of WHO is a bloke, as you know, Dr. Tedros Adhanom Ghebreyesus. But he's a member of the Ethiopian Marxist-Leninist Party. How did he get the gig? Well, with China's support, because Ethiopia at the time was negotiating billions of dollars in loans from Beijing for a railway that links the Ethiopian capital, Addis Ababa, to neighbouring Djibouti, to avoid being buried by, quote, serious debt woes tied to China's controversial infrastructure push. Where have you heard that before? To the point I raised yesterday, which must be taken seriously, yet we've not heard a squeak here from government. As I mentioned, the WHO met in May to discuss proposed amendments to the international health regulations about how countries would respond to public health outbreaks that crossed borders and what WHO responsibilities would be in response. Amazingly, or perhaps not so amazingly, it was the appalling Biden administration, there we go again, that proposed amendments that would have dramatically expanded the scope and authority of the WHO at our expense. Chris Smith, a member of the United States House Global Health Subcommittee, warned, and I quote, the alarming amendments offered by the Biden administration to the WHO's international health regulations would grant new unilateral authority to WHO Director General Tedros Adhanom Ghebreyesus to declare a public health crisis in the United States or any other sovereign nation without any consultation with the US or any other WHO member. Specifically, he said, the Biden amendments would strike out the current regulation that requires the WHO to consult with and attempt to obtain verification from the state party, that is the nation, in whose territory the event is allegedly occurring, unquote. In other words, we're one of the 194 members. We would have no role in responding to an infectious disease that would be decided by a corrupt and complicit UN bureaucracy. Now, thankfully, this World Health Assembly, of which we, Australia, are a member and on the executive board, did not accept the absurd amendments by the Biden administration. This international pandemic treaty has therefore been pushed out into the future. But don't get too excited or be deceived. Time will be used to develop even more diabolical policies which undermine the sovereignty of every one of the 194 members of the WHO.